It's now my great pleasure to hand over to somebody that is well known to you, and that is Professor Allan Fels. He needs very little introduction, of course, most notably one of the commissioners on the that assisted in the delivery of the most impressive recommendations from the Royal Commission. Allan has been a great supporter of mental health and, of course, a great advocate. And since the creation of Mental Health Victoria, has provided some extraordinary wise counsel to us. And can I now invite Allan to speak at this important event? Thanks, Allan. Nice to see you.
Thank you very much, Damian, and you. And I'm actually really pleased to be able to speak at this event. I even made a couple of special arrangements to make sure I wouldn't miss it. So let me say a few things about Gus. He started with the organisation in 2017 when it was VicServe. And of course, at that time and since, there's been immense change occurring in the sector. One of the really big ones early on was the advent of the NDIS. And in recognition of the need to rapidly change the organisation to better meet the needs of members and Victorians living with mental illness, he, helped by others, including Damian, but many others, but he led the transformation of the organisation in Mental Health Victoria, the peak body for the Victorian mental health sector. And as you all know, MHV membership was broadened to include a very diverse range of stakeholders, NGOs, private providers, community services, clinical services, peak and professional bodies, and individuals, including individuals with lived experience, working in or with an interest or commitment or involvement in mental health. And so the launch occurred in June 2018, and that launch coincided with one of the real flagship publications of MHV, Saving Lives, Saving Money, which outlined the dire need for significant investment in Victoria's then falling and failing mental health system, and included the input of over 40 organisations. And bringing this sector together to push for radical change, as the Minister said, but undoubtedly it has contributed to the influence and pressure behind the government's decision to launch a Royal Commission, and then, as you know, to follow through with a commitment from the day of the launch to implement its recommendations. And we're now seeing that, of course. But with that brief to pursue system-level reform, Gus, in a fairly short space of time, established the organisation as a major stakeholder in the mental health sector. And he brought to the role a real, genuine desire to bring the sector together. He's forged and strengthened relationships with governments, organisations, individuals, including those with lived experience and families and carers, and ensured that MHV is a recognised and trusted name in mental health. Its vision is to ensure that people receive the mental health care they need, when they need it, where they need it. And it's obvious this drives the exceptional work that comes out of MHV across policy, engagement, and learning and development. And given the size of the organisation, Gus has led a relatively small team to do some truly great work within the sector. So as we embark on a period of really significant reform in Victoria, Gus has ensured that MHV will continue to be a trusted voice of leadership and knowledge. I want to wish Gus all the very best in his new role as CEO of On the Line. We all know, I know, that he's a person that is both charming, pleasant, and honourable to deal with, but he also gets results. This is sometimes a rare combination in life, but Gus is able to do that. So I wish him all the best, and I pay my deep thanks to him for his great contribution to MHB. Thank you.